Ma'am, can I see your ears? Yeah, that's enough. Now smile nicely. More.
My teeth
I
are
know,
not visible.
but I still want you to smile. Okay, right. Perfect. Right. So, ma'am, your main issue is in your middle third of the face. Okay, this part. That upper jaw, it has not grown. आगे भी नहीं आया है, नीचे भी नहीं आया है. It has to grow both forward and downward. So then that will give you not only a good proportion, it will also give you better speech, better breathing, better eating, and of course better aesthetics. Everything in one go. Now show me your teeth. See, it is like this.
Yeah.
So normal term, this is called underbite. Underbite matlab bite is corrected. But that means only horizontal. I'm not going to do only horizontal for you, because then what will happen? Yes, there will be an improvement from now, but if you look at your scan, you need both horizontal and vertical. So what I will do, we will cut your jaw and then bring it forward and downward in a clockwise fashion. Understood? Okay. So your jaw will come forward and downward. Two things will happen because of that. This height will increase between the eyebrow and the upper lip will increase. Teeth will come forward. All these grooves I will reduce. Your nose will also become better because I'll work under the nose. Your nose is sitting on the upper jaw, so I'll work under the nose. So your benefit is not just your upper jaw, not your teeth, but nose and the jaw. And because we're doing that, I will also do little work on your lower jaw to give you a much, much more balanced face. So 80% or 70% of your work is on the upper jaw, lower jaw 30% or 20%.
But doctor, I don't want to go for face makeover.
No face makeover. I'm just telling you the logic. So that's why I'm saying 70-80%. So let's say you don't want lower jaw, we leave it aside. Only the upper jaw we can do and leave it.
Okay, that will give a better result.
Of course.
Yeah, I have a major concern about only my upper jaw.
But I know, ma'am. I know.
Yeah.
But you see, the problem is 70-80% upper jaw, but there's a little bit residual problem in the lower jaw because our jaws are related.
Okay.
If this one doesn't grow, the other one also doesn't grow. If this one, so that's why we have to budget both.
Okay.
So for 100% result, you will have to give me permission to operate on both the jaws.
Okay.
But you're like, no, I'm just okay with the upper jaw. It's not the ideal, but I can do that as well. We can do that.
Means I need a bijaw surgery.
If you want the perfect thing, bijaw will give you the best result.
Okay. And
do you have snoring?
Yeah, sometimes when I'm tired, no, that time.
So then bijaw is the best thing. That snoring part, all of that will get cleared.
Okay.
Yeah.
Otherwise, if I only go for the upper jaw,
there still will be improvement.
It will be improved.
There will be still improvement, but you know the bite
won't be proper.
Yeah, the chances of bite being not so proper is higher, you know. So that we have to take. This is just for me to measure the bones now. For that, we'll do the next scanning and we'll plan.
Okay.
So that is why we generally do, when the bite is included with severe deformity, we do bijaw.
So my bones are already grown. No, they won't be growing further.
No, they
right?
won't. No.
Okay.
They can't grow now.
Yeah, they can't grow.
So we only going to cut the bone, move it in a new place, and fix it with plates and screws.
And the lower jaw, you will also cut that also?
That depends on how much you want to do. Ideally, yes, both little bit adjustment has to be done. 70-80% of the upper jaw work, and that's why I'm giving you a percentage for you to understand.
Okay.
Yeah. See, at the end of the day, this is a cosmetic surgery. Understand that.
Okay.
Right? आप किस लिए करा रही हैं? That's because आपको और अच्छा लगना है. हाँ, इसके साथ biting better हो जाएगा. हाँ, इसके साथ chewing better होगा. हाँ, इसके साथ आपका smiling better हो जाएगी. But तो ये आपका मतलब क्या है? You're going to look better, you're going to feel better, you're going to do it. So it depends on you. Because another procedure on the lower jaw means extra costing, means extra time for recovery, but means that you get a slightly better result. So 80%, 70% of the costing also will be in the upper jaw only in your case. See, because we are doing multiple osteotomies, multiple types of procedures on both the jaws we can do. Depending on where the problem is, depending on what the patient needs.
Okay.
It's not that we do one thing for everyone. So that's why I'm giving an explanation of all of this.
Okay, fine. So when can we do the surgery?
Earliest will be day after tomorrow morning.
Day after tomorrow morning.
earliest. If you okay today, because we have lot more back end work. You have done one scanning, we will do two more scanning. So the other one is of course the dental thing they will scan, and one more a CT scan, and we'll incorporate that into a software, do a morphing, prediction tracing, printing of the splints, mock surgery, then surgery.
Okay, and how much time it will take for me to heal?
So 1 week here and 4 weeks in all.
4 weeks in all. The swelling and everything will go in how many days?
So primary healing in 1 week, secondary healing in 1 month, tertiary healing in 6 months. 6 months meaning like how you're feeling your lips and nose, that will take so long for you to feel the same way then.
Okay. But I will be able to do my regular work, no?
Next day.
Next day.
Yes.
Okay.
Everything next day or the same day. Talking, regular work, eating, walking, everything.
Okay. And the pain?
Bearable limit on a scale of 0 to 10, maybe 2 or 3. I won't say 0, but little 2 or 3. If you have pain, you should tell us so we can give you medications to just reduce it. But pain is not going to be a concern. What will be a bigger concern is usually diet and chewing. Because it takes a while for the muscles to work, new position of the jaws, swelling. So we will put you on some diet and you might lose some kilos.
Oh, that's good. No problem.
Just saying.
Yeah.
And that's going to be for a little long drawn period, right? 3 weeks, stuff like that.
Okay.
And also another thing you must remember, sometimes we advise patients to go for aligners or orthodontic braces. So if we advise that to you, and I'm not the specialist for that to do that part of the treatment, we have another doctor for that. If she advises you for that, then you should either get it done here or back where you are. That option is yours, but you should get it done.
So that will be immediately after the surgery?
Usually we will do it, if you're taking it from us, they will give you everything immediately within
Okay.
by the time you leave. Or if you're getting it done there, after 1 month or 15 days, you can start.
Okay.
That depends on the case. In your case, we'll tell you all the details. Just keep in mind that that could be an after thing that you will need.
Okay, fine. नहीं कल नहीं परसों morning earliest. Friday morning.
चलेगा ना सर फ्राइडे मॉर्निंग? नहीं
It's like we have to reach Ahmedabad as early as possible.
As early as possible.
वापस पहुंचना है आपको. तो हम क्या करते हैं ना, आज आपको मैं बता दूंगा डिटेल. देखो इनको हाइपरटेंशन भी है, तो बेटर आप ब्लड टेस्ट पूरा करा लो, एनेस्थेटिस्ट से मीट कर लो, क्योंकि वो क्या करते हैं बाद में बोलेंगे आपको इसी जगह बाद एक्को कराओ, उनका लाइन है वो सब करानी है. तो अब आज सारा कुछ खत्म कर दिया तो आप एक दिन घूम लेंगे, क्योंकि हमको बैक एंड वर्क भी होगा. फिर जब आप आओगे कल शाम को या परसों सवेरे, सर्जरी से पहले आपको दिखा देंगे वो कंप्यूटर में क्या क्या हो रहा है, कैसा स्प्लिंट रेडी है, सब कुछ.
इसमें बोल्ट वगैरह भी आएगा?
आएंगे सर.
तो वो कब निकलेंगे?
वो निकलेंगे नहीं,
वो ऐसे ही.
वो तो रहेंगे इनके अंदर.
So that doesn't create any problem.
कुछ नहीं होता.
Baby कुछ मालूम नहीं पड़ता.
तो हर रोज होते रहता है ऐसे, आपको उसमें कोई टेंशन की बात नहीं है. मैं आपको एक उदाहरण के लिए बताता हूँ, एक जो कल नहीं किया था आपको, जस्ट बिकॉज इट्स वेरी सिमिलर. अब ये देखो आपका जैसे ही है, बट इनका लोअर में भी प्रॉब्लम था. तो ये देखो, देखो सर्जरी के बाद ये लुक लाइक अ मॉडल. लुक एट द चिन, upper lip, lower lip, angle, jawline, everything. So what I'm trying to say is, so this is
My face won't change too much.
you can see this change.
Yeah, this I can see.
Same will be
See
there
the-
for you. Or I'll show you some more similar change. Your face will look 10 years younger, minimum. Minimum. I will show you. You have to give me some time to search for a similar photo, but I'll show you. It will be looking very. Look at this.
Yeah, right.
I'll show. This one. Yeah. So she also looks younger. Even this one you can go. You look younger.
Yeah.
And your face will look more angular. Now it's more of a round. It's going to look a little bit more angular. The jawline is going to get a little defined maybe. These grooves are going to get lesser. Nose will look better. So I think he's going to be happy.
He's worried actually now.
Why is that?
He's just worried like,
He's going to look too beautiful.
no.
Then what? Worried about the pain you're going to go through? दर्द नहीं होता ज़्यादा पेन, डोंट वरी, दर्द नहीं होगा आपको, क्योंकि ना ब्लॉक कर देते हैं और एनेस्थीसिया में करेंगे, जनरल एनेस्थीसिया में। दर्द का तो आप टेंशन छोड़ दीजिए, खाने पीने का ही थोड़ा दिक्कत रहता है पेशेंट्स को। और अब ये आपको प्रॉब्लम नहीं है क्योंकि आपका एज 40 है। जब 25-20 के पेशेंट आते हैं ना, उनको तो चिकन या जो भी है खाना रहता है, खाना देखेंगे छोड़ नहीं पाते ना, उनको उनको वो प्रॉब्लम ज़्यादा रहता है। आप कंट्रोल कर पाओगे तो मतलब वही एक थोड़ा एक रहता है।
And age is not a matter, no?
नहीं, मेडिकल थिंग इज अ मैटर, एज इज नॉट अ मैटर। 70 में भी कर सकते हैं एज लॉन्ग एज यू फिट फॉर सर्जरी। तो वो फिटनेस तो आपको एनेस्थीसिया लोग दे देंगे। अगर हार्ट में कुछ प्रॉब्लम है और कुछ प्रॉब्लम है तो फिर उसको सेपरेट लाइन पे वो लोग आपको बताएंगे। मैं तो सिर्फ आपको ये सर्जरी का बता रहा हूँ अभी।
Okay, तो anesthesia
आप सब करेंगे तो
हाँ।
ब्लड अभी तो बेसिक हुआ है,
हाँ।
फिर आप उससे पहले स्टाफ से बात कर लीजिए कि आप बिल्डिंग है तो वो आपको कॉस्टिंग बताएंगे। आप एनेस्थीसिया सब कुछ करने के बाद कॉस्टिंग पूछो तो वो पूरा वेस्ट हो जाएगा। तो हाँ,
नहीं विलिंग तो है उसके लिए,
पर फिर भी पूछ के वो कंफर्म करके फिर एक कर देना। ओके मैडम,
ओके, थैंक यू।
वेलकम।